So Bowdoin and Bates colleges have both experienced outbreaks of mumps this fall. 8 students at Bates and Lewiston have been diagnosed with the highly contagious virus since early October. They have since recovered. Diane Atwood is here with a little bit deeper look into the virus and the outbreaks. And Diane, the numbers fluctuate every year. Good morning.
Good morning. Took me by surprise. I didn't realize we were on the air there a second.
Here we are.
Sorry,
here we are.
Yes. So every year, maybe a couple hundred, a couple of thousand, but it's actually a dramatic drop since the late 60s when they developed a vaccine. It's like a 99% drop.
Okay.
So it's pretty rare.
But there are some outbreaks going around, seem to be hitting college campuses. Let's talk about the symptoms so people know what to look for.
Okay. Classic symptoms are that puffy cheeks, and that's because there are salivary glands like right underneath the ears, and they become swollen. And other, like you get if you had the flu or another virus, you know, the achy body, chills, fever.
Okay, so it could mimic the flu, but maybe the telltale sign is the swelling
The
here.
swelling. But some people get very mild symptoms. Some people don't get any symptoms.
Okay.
Yeah.
Oh, okay. We've said it's contagious. It's highly contagious. It's a virus.
Right. The reason you're most apt to find it in college campuses is because it's close environment in there, you know, kids going to class together, living in dorms together, but it's spread through the saliva and mucus in the throat, the nose, the mouth, and before a person even gets symptoms, they can be sharing the virus with people, you know, through normal things, sharing a cup, sharing utensils, coughing, sneezing, not washing their hands, the usual.
All right, and there is a vaccine for this, and you mentioned that the number of cases has gone down since the 60s when we first started vaccinating people.
You know, the other thing besides living in a close environment is that we may be seeing more cases in the future because parents are opting out of getting their kids their routine vaccinations. But I spoke with Dr. Lisa Ryan. She's a pediatrician at Mercy Hospital. So she says that most people get the mumps, they recover just fine, but mumps can cause some serious complications. And so the current vaccine recommendations that she says we should follow are the routine immunizations for measles, mumps, and rubella. That's MMR at 12 to 15 months, and then a second one at 4 to 6. And college kids should get those 2 vaccinations if they didn't get them as kids.
Did you happen to ask? I had the mumps when I was a kid.
So
are we safe?
Yes, you should be. You should be immune, but you don't want to fool around with it. Even if you don't get so sick, you know, as I said, there can be complications. Meningitis, encephalitis can cause orchitis, which is inflammation of one or both testicles, which could lead to infertility, deafness. So it's not something that's just innocuous, you know, that it can cause trouble, or it can cause nothing. You know, you might not even know that you have it.
Isn't it interesting? It's interesting how it affects different people. But anyway, nothing to trifle with at any rate.
Absolutely.
All right, Diane, thanks for coming in.
Yeah.
We'll see you again soon.
I hope so.